I am delighted to pass the baton to Emily Bancroft, who's the CEO of Village Reach, and she is going to introduce your panelists to talk about the future. Thank you very much.
Great. Thank you so much, Krishna, and everyone that's spoken so far. Working with this CAF Africa team, both at the regional and the country level over the last 9 months, 10 months, has been such an honor and a pleasure. So it was great to hear all those voices and to hear so many of the partners that have been involved. As you've heard, this really has been a true collaboration. 18 ministries of health, over 30 partners coming together. And so just a really, really amazing thing to be a part of. But there's another part of this collaboration for us, and that is how do we make sure that this effort, which was really intended to be, as you've heard, sort of an emergency stopgap effort, how are we linking into other global, regional, and country level efforts that are also trying to address this problem in order to reduce duplication efforts and in order to be more aligned and to look at how we support this in the future? So I'd like to now, I have the honor of facilitating a panel that's really going to be looking at some of these other experts, some of these other efforts that have happened in the community and in globally, regionally, and at the country level over the last year, so that you can hear a bit more about what else is happening and how we can leverage some of these efforts to solve these problems long term. So I'm joined by 3 incredible experts in global, regional, and country level supply chains, infection prevention, procurement, financing. So a really, really great panel joining us today. We have Prashant Yadav, who's a senior fellow at the Center for Global Development, an affiliate professor at INSEAD, and a lecturer at Harvard Medical School. And many of you know him as one of the key experts on supply chains and procurement in the healthcare space. We have David Lawrence, who's a senior advisor at the Global Fund, really focused on health security, technical advice, and partnerships. And we have Chitima Efepe, who's the managing director of the Africa Medical Supplies Portal, which is a really important effort of the African Union that also spun up during this time, and has been another contributor to addressing some of the long-term supply needs for countries in Africa. So thank you to all 3 of you for joining today. I'm going to start with Prashant. And Prashant, you may have seen in the chat already, there's quite a bit of interest in a number of issues around procurement that I'm hoping you can touch on. So our previous panelists talked about some of the real challenges that we faced during procurement in a pandemic. Some of those things, relationships with vendors, pooled procurement and finance demand, global versus local procurement, all these things have sort of come up as themes in the discussion so far. And so you've really been looking at the PPE market, both how it was utilized during the pandemic, as well as what some of the future trends are. So can you share a little bit about what you've learned and also what you see happening in the future? Oh, and Prashant, you're on mute, sorry. Gotcha.
Thanks, Emily. And I want to start by congratulating all of the colleagues involved in the CAF Africa work. I just heard the figures from Andrew, and it is mind-blowing that you all have been able to do both such a large volume, but also to get it to places which are oftentimes the hardest to deliver to in the supply chain. So commendable effort. I want to start by saying that when we think about procurement architecture for PPE, and there are relationships to many other health products, we should start from the standpoint of the end user and figure out, and the end user here could be the community health worker, or we can then slowly start aggregating and asking where do they obtain their supplies, what would be the vantage point of where they get their supplies from, etc. And then we quickly realize that we want to think about pooled procurement. We want to think about regional, global, national pools. But at the same time, we want to give them choice. And when I say choice, I'm referring to a future state of the world in which groups want to say, I want to get my PPE supplies from whosoever can give me the best lead time. Someone else says, I want to get my PPE from whosoever can give me the lowest price. And there are trade-offs intrinsic in this, but in the times of an emergency, the group that knows how to solve the trade-off is the country, is a coalition which is acting on behalf of a certain group or a certain stakeholder group, in this case, community health workers. And so I think that's the starting point for thinking about procurement architecture, which is in the times of emergency, people will have slightly varying preferences for what they care the most about, and rightfully so. Sometimes people may be willing to give a slight price premium in order to get very rapid response delivery lead times. Then I think if we look at the upstream side of the market, we know that it was a market which was heavily supply constrained. Lots of question marks about how do you ensure quality in a market which is very fragmented on the supply side. Hundreds, oftentimes thousands of suppliers for certain categories of PPE. And the number and the fragmentation of the market continues to be higher when you go to categories of PPE such as gowns or face masks. It's a little bit more concentrated when you look at respirators and other forms of PPE. So I think in buying from such fragmented market where quality is not very clear and it's hard to establish, even with enough time and resources being put into ascertaining quality. And on the other side, you have end users of PPE who want some choice, and then finding the mix that balances these two somewhat at tension aspects is what matters the most. And I think the interesting part, what we've seen is that if you look at the data that has come out from the ex post analyses of the procurement work for COVID supplies, including PPE, we realized that about 30–40% was through the WHO coordinated sell, but then there were private market purchases of PPE where countries were buying directly. There were other aggregators like CAF Africa, and then there were people buying from UN agencies. So I think all of those channels were working. And I think that's perhaps the way we will see the future state as well. We were not always perfect in exchanging information, but I think that's another area where coordination and information sharing hopefully will get better as we think about the new work on preparedness and architecture for preparedness and procurement. But I think one additional item that stands out is that forecasting, and I think it was referred to in the past, is an important signal to the market to get ready for the future. Right? So if we ignore some segments, if we completely ignore millions of community health workers in the forecast that we come up with, the market, which is now responding to build additional capacity to ensure that we have not just finished product PPE, but the polypropylene fiber, or perhaps even backstage manufacturing setups, the risk of ignoring this big segment can be a big risk for the future. So I think I'm glad that we've been able to at least put out some ideas in terms of here is the total demand. I think it's an important activity that perhaps we can keep updating. And I think embedded within this is the idea that community health workers, which are not as directly plugged into the formal health system in many countries, their demand or the forecast of what their needs are isn't necessarily aggregating or trickling back up into the national level procurement forecast we are seeing. So as a result, we have this group whose demand isn't naturally coming to the larger procurement efforts, whether it is regional ones or global ones. And we need to think very carefully about how will we bring them back and plug them into a global architecture. And again, repeating myself here, but the global architecture doesn't mean it'll be a single procurement entity that buys PPE for everybody together.
Yeah, no, Prashant, I think you've made so many really, really key points there. And I want to come back to you in a minute after we hear from the others to talk a little bit about local procurement as well and what you're seeing in that market. But let me build on something that you talked about, which is choice. And really the starting point of the procurement architecture being at the country level. And I think that's a place where our other two panelists are really engaged. So Chidima, I want to turn it over to you. the African Union's Africa Medical Supplies platform launched in the midst of this pandemic. It launched in June of 2020. And you've been involved since pre-launch and during this whole thing. And so, you know, I think part of what this portal spun up to do was to help with some of this choice and some of these options for countries and for African Union member states. So can you talk a little bit about, you know, the problem you all were addressing, how that ties to some of these themes that we've heard today, and sort of what then is the future, and what are some of the things you're really excited about around what the African Medical Supplies Portal has been able to do?
Thanks so much, Emily. So the African Medical Supplies Platform, like you rightly said, it was, you know, it came about right in the middle of the pandemic. And the AMSP, it's really a digital marketplace that also serves as a pool procurement mechanism for the continent. So what you quickly realized, you know, when we were in the middle of the pandemic, where there were two levers we could pull as a continent. One, leverage the collective volumes that we have to negotiate downwards some of the prices. Two, provide manufacturers with a very strong financial entity that will guarantee their payments. Because a lot of times you see that some of the manufacturers also kind of shy away because historically they know, you know, Africa, they don't usually will procure this large amount of products at a go. So the AMSP started, you know, from these two levers. And it's interesting that since we started, we've been able to, you know, form very strong partnerships with a lot of the manufacturers that are supplying some of this critical medical supplies and equipment. But I think what's most interesting for us is when we started the platform, I think we had in the first few months, we had something around 100, just a little over 100 million in orders for, like in gross orders for PPEs. So the demand around PPEs, it was really strong, you know, just around that June, July, August period. So that kind of demand was also one of the key, you know, categories that had been requested for by the African CDC. Strong, huge demand, so much complaints around the quality, you know, that they were seeing locally. So they wanted to kind of leverage some of the pre-qualified WHO merchants or manufacturers that we could access through our own network. So AMSP, if I could just summarize, you know, what some of the challenges we really wanted to address. We wanted to make sure on the continent there was proper availability of some of these critical medical supplies. I mean, we were all working in a supply constrained market. So it was literally fighting for any bit of products that we could get. And what was also critical for us is to ensure that we got immediate access, right? So, you know, what we had seen when we went into the market was there was some sort of, you know, invisible scale of preference. People that came in later into the market had to wait a longer period to access some of the products. One other thing that was one other challenge we wanted to answer or to provide a solution for was around the cost and transparency. One thing that we were a bit overwhelmed with when we got into the market was just the very wide assortment and wide range of prices. You know, we could see masks that go for as high as $7, $10. Because of the arbitrage that was created, you know, there was a lot of price gouging. Some people were getting them from the manufacturers at really, really low prices, and just because of how scarce it was, the prices were pretty high. So we wanted to really address fully that conversation around cost and transparency. And I think this point is really, really important for us because we were working with a varied group of countries. We had countries with really large population sizes that had the capacity and the capabilities to order huge quantities of products at a time. But we also had countries with smaller population sizes that wanted to buy, you know, just what they needed, especially because they were all working from very constrained federal reserves.
Yeah.
Not everybody was getting, donor funds. So the AMSP kind of addressed some of these challenges I've just mentioned. And as we go on, I'm just going to talk a little bit about how we've also evolved as a platform and how we are supporting the communities. Thank you.
Let's come back to that, because again, I think also a great point. And I just want to reference this stat that Prashant mentioned as well, which is that 30 to 40% of country demand was met by sort of this big pooled procurement effort, very, very important effort that the WHO did, but that leaves 60% of demand that was met through other channels. And so I think we can't stress enough that there is a need for multiple channels and multiple platforms. There is also a need for countries to be able to pool their demand. That's something we benefited from in CAF Africa, being able to pool that demand. And it's something, Chidima, that you're talking about a lot of the member states of the African Union needing to be able to do because of the way that their financing works. So I think just a really incredibly important component. So David, the Global Fund has been one of the leaders, when you think about the global partners and sort of who's taken the lead on PPE access issues, and both sort of shaping how PPE was accessed during the pandemic with the resources that were available, as well as looking forward at what does sort of innovation in PPE look like, what does the PPE market look like moving forward. The Global Fund has been right there front and center through a lot of this, and has also been really front and center in community health as a really critical component of country level response, not just to COVID-19, but to the disease priority areas that the Global Fund focuses on. And you are in the midst of launching some pretty incredible new resources that countries can access through the COVID-19 response mechanism that the Global Fund has just put out new guidance on yesterday, I believe, or even yesterday. And so love to hear you talk about how can countries use that to actually meet their future needs.
Thanks very much, Emily. And let me offer a quick appreciation for the invitation to the Global Fund to participate in this really exciting panel and session. So as you say, Global has been a strong advocate for community health and community health workers in addressing both direct and indirect health impacts of COVID-19 on communities. And I think that's really well reflected in comments from Peter Sands, our executive director, early on in the response, when he said that one of the top priorities in the response has to be protecting and strengthening community health workers. And this is really seen as a requirement if we're going to keep health systems funding countries maintain the incredible progress that's been made in reducing morbidity and mortality from and incidence of HIV, malaria, and COVID. So from the beginning, infection control and protection of the health workforce has been a pillar of the Global Fund's response strategy, of course, in line with WHO technical and operational guidelines. So let me mention just a few things, specific things that Global Fund has done to support countries in protecting their health workforce, including community health workers. So when COVID hit, the first thing that Global Fund did was to quickly allow grant flexibility. So countries were able to reallocate portions of their existing grants towards procurement of PPE. And they also opened up their global procurement platform as one of the options, WOMBO, as folks will know, to help countries with active grants for quality products, including PPE. At the global level, within the ACT-A framework, and really with a mind to creating a more systemic approach to ensuring that communities and healthcare workers are protected, Global Fund and Welcome launched an initiative called Rethinking PPE, which has brought together a coalition of partners to look at the full value chain with a country lens, from innovation, manufacturing, procurement, supply, deployment, utilization, and disposal. And then yesterday, as you mentioned, the Global Fund launched the second phase of the COVID-19 response mechanism, or C19RM. And this is presently at a level of about 3.7 billion in financing, which will provide opportunities for countries to support their COVID-19 control and containment interventions, including PPE, diagnostics, critical therapeutics like medical oxygen, as well as activities to mitigate effects of COVID on HIV, TB, and malaria services and support key health and community systems. So I wanted to talk a little bit more about the second phase of C19RM and really talk to the point of how do countries access it? What's it all about? So first of all, again, it's important to underscore that C19RM is limited to countries that are current recipients of Global Fund resources. Now, that good news is that that's about 120 countries in total, including some of the regional grants. So quite a wide global coverage. There are no specific programmatic earmarks. The funding requests will be developed by the country coordinating mechanisms, which are the central governing authorities, of course, in most countries. But they're going to be doing that in close collaboration with the national COVID response coordinators and coordinating bodies. And we'll focus on addressing gaps and priorities in the national COVID response plans. So we very much understand that countries need equipment, therapeutics, and supplies now. And so there's been some segmentation in terms of how these funding requests will be developed. There's a fast track that is heavily, which we're hoping will really accelerate and ensure that we can get these products out to the field, including to communities and community health workers as quickly as possible. And then there's a second or subsequent windows, which will allow for more comprehensive funding requests, where some of the health and community systems dimensions and mitigation aspects will likely be reflected. It's also important to mention that the funding requests do require that countries quantify their health workers, including community health workers, importantly, and define the needs of protective equipment. And this is a real opportunity for countries to build on the quantification work done through CAF Africa and other partners to make sure that PPE and supply needs of the full health workforce are reflected in these C19 funding requests and other related efforts. So let me stop there, Emily, and back to you.
Yeah, that's great. And I mean, 3.7 billion, that's, I hope that everybody listening, perked up their ears at the country level, really thinking about how countries can leverage that to meet these ongoing needs. And because it's a quick, turnaround, and we are in the midst still of the need for emergency response mechanisms, how do we build on some of these efforts very rapidly to make sure that the needs that are quantified are really representing that full health workforce. So thank you, David, and thanks to the Global Fund for their work in this area as well. I want to touch on local procurement because it's come up in the questions and the comments, and it's always something that comes up. Andrew mentioned we were able to do some local procurement under CAF Africa this year in 2021. But I wonder, maybe Prashant and I'll start with you, and if Chidima also wants to chime in on this in just the couple minutes that we have left. What is the state of the state for sort of manufacturing of PPE on the continent, and how much will that change sort of the market and how things look moving forward? Prashant, do you want to comment on that? Are you able to comment on that?
Yes, I think, Emily, it varies considerably depending upon the type of PPE. So for respirators, it is trickier because it requires specialized capital equipment, and we don't have very many manufacturers who have the kind of capital equipment that's needed for respirators, in particular the N95 and the KN95s. On the other side are products such as nitrile gloves, where the manufacturing is very concentrated in regions where the raw material comes from, and just the value chain costing doesn't necessarily create a lot of opportunity for manufacturing locally, not just in Africa, other parts of the world. I mean, everyone will have to face that concentration in the value chain of nitrile gloves. There are lots of things in the middle, surgical masks, aprons, gowns, where we are starting to see a lot more local manufacturers come up in Africa, some which were helped by global agencies, development finance institutions, some who did it on their own. But all of them continue to face the challenge that the demand side of the market for them is very fragmented. They don't know the channels of how to sell to the Global Fund. They don't know how to sell, in many cases, even to the African Supply Management Platform. So I think our challenge on local procurement will be, as new local manufacturers come up for especially these middle categories of PPE, how do we create for them a market connect platform that guarantees price, quality, delivery terms, those three variables that are extremely important, and put some more transparency on that and allows them to be a part of a larger sort of competitive procurement system structure.
Great, and I think that's a great segue to Chidima. Do you, how much are, how much are you all linking into sort of the local markets in Africa? How big of a component is that for you? And then also maybe if you can tie that into what's next for AMSP, sort of how are you looking at, your ongoing priorities as a platform as well?
Thanks, Emily. I mean, the local markets, the local distribution, local manufacturing, it's been a big topic internally for us because the opportunities are massive. We've also been part of, working groups and working sessions where we had to think through what were the possibilities and how do we finance, what role do we play in the future of locally manufactured products for the continent. And I believe that while the pandemic has offered us a good, opportunity to kind of really critique, and discuss what needs to be done to build the capacity that is needed. And when I say capacity, I don't mean just the infrastructure, but I also mean like the human capital, just, the regulatory frameworks and things like this. It's something that obviously work has already started on that. And it's interesting to see with, for example, vaccines. And I know we're not talking vaccines here, but I mean, with vaccines, we know there's Aspen in South Africa that has a plant there. We know there's Institut Pasteur in Senegal. We know this in Egypt. They've already started talking, I think they've already signed with Sinopharm to, pack and fill the vials of vaccine in Egypt. So the conversations around local manufacturing, they have evolved massively. But to Prashant's point around, us being able to manage price, quality, and delivery, I think it's the same kind of 3 points we see when we have the conversations, right? We need to make sure that whatever we are producing, we're producing in such a way that we can manage the pricing and it's as competitive as what we get externally. We also need to manage the quality, and we need to talk a little bit wider around the regulatory systems that we have on the continent. And now it's really wide. I don't want, it's really, if you produce a product in South Africa, you still need approval from the 54 different regulatory systems on the continent. So we're still talking and pushing around the African Medicines Agency being ratified to be able to ease some of the constraints we see around the regulatory frameworks for the continent. There's also the bigger question around the delivery timeline, and the African Free Continental Trade Agreement is supposed to be one lever, to bridge some of the constraints we see around intra-Africa delivery. So there's good progress happening, but there's just a lot of work that needs to be done. In the meantime, we have these conversations and we support as much as we can. And I think this is really important, as this is also part of our growth plan as a platform. AMSP was also commissioned. One of our mandates is to also promote African suppliers and African products. But because we also did not have like the range, I mean, we are also really a buyer's platform, right? Buyers, we will stock what the buying entities want. And at the time, outside of PPE, is one of the biggest categories that we had requests for was diagnostic kits. We don't have any manufacturing structure that could offer that on the continent. So around pharmaceuticals, I mean, we keep having these conversations around where we want to see ourselves in the next 5 years, financed by local production. But I think what I'd like to leave us here around AMSP's plan is we are now expanding past the COVID catalogs and portfolio to addressing some other non-COVID related pharmaceutical needs. And that's where the platform as an organization is headed. Thank you.
Great. And I could talk to the three of you for a long time, but in the interest of time, I do have to turn it back over to my colleagues to close us out. So I want to say thank you to all of you. So much has been accomplished this year. the financing and technical platforms that you, all three of you, have been involved in helping to set up are such a critical part of this response. So thank you. Now, we do know the work's not finished. We need to ensure that these channels and mechanisms are understood and are actually utilized and help to build the strong supply chains in country and globally and regionally that we need to meet community level demand. So thank you to all three of you. That's a role that all of us here on this webinar can help to play, and we look forward to working with you moving forward. So I am now going to turn it back over to my colleague and collaborator, Mila Nipanishi, who will just remind us all of the actions that we can take to make sure that we're protecting the community health workforce now and in the future. So Mila.
Thank you so much, Emily. Thank you, Krishna. Thank you to all our panelists for your contributions. I'm going to leave you with 3 key messages. Number 1, make sure community health workers are counted. We can all do this now at the country levels, at the global levels. There's so many examples. Let's keep ourselves accountable. Number 2, we know there are huge gaps between supply planning and community health efforts. Let's do our best to narrow that gap through integration at planning and execution levels. We can all do that too. And finally, we need multiple sources when it comes to procurement. We have to make sure that these are responsive, that these are transparent, they're agile, responding to local and regional needs, and they need to be in place for routine supply needs and also for future pandemics. To the many partners and over 200 donors who gave gifts of so many various sizes, thank you for your support to community health workers. Please stay in touch with us. Please share any questions you have with us. We will get back to you after the webinar, and we will also include the feedback in our final report, which we will disseminate in about a month's time. Thank you, and have a great rest of your day wherever you are.